Hello, my name is Liz Highleyman from Health Education Online, and we're here at the 25th Conference on Retroviruses and Opportunistic Infections in Boston, and today we're going to talk about hepatitis C. Today I have with me Christoph Boescke from Bonn University in Germany, and Boerekamps from Erasmus University Medical Center in Rotterdam. So I'd like to ask each of you to briefly describe the research you presented here today and sort of its implications for public health. Dr. Boescke?
So we had a look at a very large European cohort of acute hepatitis C infections and HIV-positive MSM mainly.
And that's men who have sex with men, gay men.
Yes, to see if how many of these clear the infection spontaneously, because as you know, the epidemic of acute hep C among HIV-positive MSM is still ongoing, and the majority is probably facing a chronic cause, and we really need to talk about earlier treatment, which is something that Anne will cover, to really stop the epidemic or at least cut down in cases. And we were able to show in more than 400 patients that only 12% roughly might spontaneously clear the infection, and that results in more than almost 90% going to a chronic cause of the infection. Those are ideal candidates for any intervention early on to get the incidence numbers down.
Okay, and your study?
Our study was quite straightforward. We wanted to see if treatment of a shorter regimen with DAAs was also effective during the acute phase of hepatitis C.
So these are the new direct-acting antiviral drugs for hepatitis C, very well tolerated.
So they are mostly studied for chronic hepatitis C, but if we want to prevent transmission of hepatitis C to others, the earlier you treat, the more prevention you will do. And in the end, in the long run, this will be cost-saving for the society. So we wanted to treat 80 patients, and at this conference we only have the result of the first 63 patients, but only one patient failed with the 8-week regimen of Graspavir/Elbasvir. So the results are very good and comparable to what was studied for chronic hepatitis C treatment with these new regimens. So about the efficacy of the drugs during acute hepatitis C, we can say that's fine.
Okay. And I guess for both of you, would you expect that treating everybody in a population or in this population of gay men as soon as they are diagnosed with hepatitis would help reduce the epidemic or potentially even eliminate it?
Yeah, I guess it would. But I think it's more a discussion about what it might cost. So treating everybody at once is very good for the epidemic, but it can have a high budget impact. But in the long run, it will cost less, because if you just let the epidemic go on and on, you get a lot of people with a lot of disease. So that in a few years will cost more. So although it will cost some money at this moment, if you treat them now, it will be cost saving in the end.
Okay, great. Anything else to add?
Completely agree.
Okay.
Treat now.
Treat now. Okay, that's the message. Thank you very much.
Thank you.